And Alberta First Nation, east of Calgary, is working overtime to deal with an outbreak of COVID-19, imposing new restrictions to contain the cluster. The Siksika First Nation has recorded 10 cases of COVID-19, and there's now concern there could be more. The First Nations chief says the risk of community transmission is high. In Atlantic Canada, COVID-19 infection rates remain relatively low and stable. There are just 5 active cases in the entire region. Their success is paying off in a big way today. All 4 Atlantic provinces are opening up their borders to each other. As Eric Sorensen explains, it's a turning point in the pandemic.
Finally, the Confederation Bridge is connecting Prince Edward Islanders to New Brunswickers once more. This couple from PEI on their way to see grandchildren in Fredericton.
Great. Feels great. You've a little freedom.
Not far away, a simple drive from Nova Scotia to New Brunswick became a breakthrough achievement. The huge numbers traveling and the patience required, a reminder of how COVID-19 has smothered life as we know it for the last 4 months.
So how long have you been waiting now?
About 30 minutes.
There are checkpoints entering all 4 provinces, slowing things down, but not dampening spirits.
Oh, it feels pretty good. We just had some paperwork completed and that we did, which was really quite easy and quite efficient.
Until now, the 4 Atlantic provinces have been in their own bubbles, and it has worked by and large. The numbers in Atlantic Canada, fewer than 1,600 total cases over the last 4 months. That represents 1.4% of the national total of more than 100,000 cases. As for new cases, in Nova Scotia, there were 2 on July the 2nd. In the other 3 Atlantic provinces, there were none. But as you go from individual bubbles to one big bubble, does that risk increasing the spread of COVID-19? The more people cross paths with one another, the greater the chance the virus will develop. In Newfoundland and Labrador, some are worried. About 15,000 signed an online petition that says the province is slowly going back to normal, and it reads, "We want to keep it that way. This is not the time to open the borders."
You know, when you move from lockdown and you start to open up, it is kind of anxiety-provoking.
This epidemiologist says it's a calculated but reasonable risk to reopen.
It's an ideal time to allow some movement so that people can enjoy the summer holidays and spend some time exploring the Atlantic provinces.
And it's an essential kickstart for tourism and the Atlantic economy, says one mayor.
The risk of illness from the virus directly has to be weighed against the stresses and the difficulties created by financial hardships and the social isolation.
It may look like gridlock, but it's a happy day. New Brunswickers going one way, Nova Scotians the other, and the hope that Atlantic Canada never has to lock down again. Eric Sorensen, Global News.
Shifting now to a very different situation in the United States. With infection numbers surging, many states are reversing course on reopening plans as they struggle to get the virus under control. In some areas, so many people are needing tests that labs cannot keep up. As Jackson Proskow reports, there are fears that soon hospitals will also be totally overwhelmed.
Backed into a corner by the virus, America is locking back down. There's now a curfew in Miami, in place indefinitely until the pandemic is brought under control. Texas implemented a statewide mask order.
COVID-19 is not going away. In fact, it's getting worse.
Chicago announced a mandatory quarantine for anyone traveling from 15 hard-hit states.
We are not going to suffer the fate that we've seen of other states and localities across the country.
The surge in case numbers is unlike anything so far. In Arizona, nearly 1 in every 4 COVID-19 tests has come back positive. In Florida, which saw nearly 10,000 new cases again on Friday, it's 1 in every 5.
I'm incredibly worried about what's happening. We had hoped for a decline in cases in order to deal with what might be considered a second wave. We haven't even gotten out of this first wave, and it's getting worse.
Now there's a new problem. Testing sites like this one in Arizona are overwhelmed. Labs can't process the crush of samples.
It's absolutely the saddest thing, the most unnecessary situation that we're finding ourselves in, and it's behaviorally driven.
The timing of the surge up against the busy 4th of July holiday couldn't be worse, and federal leadership has been virtually absent. President Donald Trump hit the links for a round of golf Friday before jetting off to watch fireworks at Mount Rushmore in a crowd of thousands with no social distancing. The U.S. Surgeon General declined to say whether mass gatherings like that should be avoided.
It's not a yes or no. Every single person has to make up their own mind.
Increasingly, there's fear about what the coming weeks will look like, with hospitals already nearing capacity and with more death all but certain. The CDC admits 20,000 more Americans could die in the next 3 weeks, with the virus now so widespread it can't be contained. Jackson Proskow, Global News, Washington.